Hi, today I'm talking with Dr. Tom from NatroNet. Our topic today is cancer diet. Dr. Tom, we know about tons of different diets you can take to help you lose weight, but when it comes to cancer, is there anything or any recommendations you can make to help people prevent cancer or even help treat it if they have it?
It's a great question, and it's actually an extremely important question because many people who have cancer are often told that, well, what you eat doesn't matter because what we're going to be doing for treatment is going to sort of overwhelm the diet.
Right.
And nothing could be further from the truth. In fact, it forms a critical component when we treat patients who have cancer of, what types of foods should these people be eating. And there's a couple of general type things that are extremely important. One of the most important things that we want to do, both in decreasing the risk, preventing somebody from getting cancer, or if they have cancer, is to supply as many different nutrients as possible. As we know, there's many different types of things we get from our food. So the most critical foods to be included in the diet are going to be multicolored fruits and vegetables. They provide the widest variety of antioxidant nutrients that are important, both depending on if a person's having treatment, whether it's chemo or radiation, that can be supportive of that to help the person who may be having some particular side effects. So the goal is to try and get 9 different colors of fruits and vegetables on an everyday basis for the antioxidant aspect. And another critical aspect that's come to light more recently, although it's not really new, is how do we control a person's blood sugar? We know that cancer cells will have a preferential for uptaking of insulin, which is involved with people who have diabetes will know something about that. But on an ongoing basis, eating a food that we call them high glycemic index foods will raise the blood sugar, and when your insulin levels go up, cancer cells will preferentially take that sugar. In fact, what you're then doing is you're literally feeding cancer cells.
Wow.
So the 2 big aspects of the diet is a wide variety of colors, and the diet that basically will help and manage and control. In fact, we often have our cancer patients measure their blood sugar after they eat certain meals, and we'll see that when they eat certain meals and their blood sugar raises, that actually is a food that they shouldn't be eating. And there's a variety of different types of things. We often look at grain-type products as potentially being involved, and it's not sugar. People say, well, I don't eat sugar. It's not really sugar. It's about what is raising your blood sugar, and grains and carbohydrates are much more likely to do that than a protein food, a vegetable food, even some fruits and that type of thing. So, yes, there's absolutely things we can do. And then, what do we drink is the same idea. How do we flush the system out? So the main ingredient from a diet, from a liquid perspective, has to be water, because we basically need to be flushing the system out. So those 3 things form the cornerstone of a cancer prevention diet or a cancer treatment diet, and then we'll individualize it to the individual cancer, and we'll individualize it to the individual patient. So much can be done about it for sure.
Good to know. Thanks, Dr. Tom.
You're welcome.